Last night we saw Romelu Lukaku go down with a very bad looking ankle injury, and this was a very concerning one right from the get-go because as soon as it happened, we saw what looked like his ankle just get twisted up in a very awkward position, and after he walked off of the field, we saw that he would not return for the match. Chelsea did get a piece of good news today when they spoke to Lukaku's agent, who said that every day he is in fact working with a physio, and that he expects, due to his hard work, to be back sooner than expected. Now the actual position that we saw Lukaku's foot go into is known as eversion, and it had a rotational component to it, and this is going to put a player or a person at risk for a couple of different ankle injuries. And there is, of course, a grading system for these ankle injuries, and since some people may not be too familiar with these scenarios, I'm going to go ahead and focus on that with this video. Welcome, sports fans. For those of you that aren't familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries, and I try to explain them so that they are a little bit easier to understand. And then I go over the anatomy of that particular injury, and finally, what the person should expect when going to rehab for that specific injury. If you like this video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we see here that as Lukaku is running, that right foot gets tangled up and it's going to twist outward like that and go into a foot position known as eversion. Now here I have a model of the foot and ankle, and so the two bones that are going to make up the lower leg, the fibula, which is right here, that is going to come on down and form an area of the ankle known as the lateral malleolus, and that is that bone that we feel on the outside of our ankle. And the bone that we often associate with as the shin bone, that is going to come on down, and that bone is called the tibia. It's going to come down and it's going to form that bony knot on the inside of the ankle, which is clinically known as the medial malleolus. Directly below these two bones is another bone known as the talus, and that is located right in through here. Now let's go over the specific movements of the ankle. The first movement is a motion known as dorsiflexion, and that's going to be when the toes are coming up just like this. The opposite of that is a motion known as plantar flexion, where a person is going to be pointing their foot down like this. And as we take a look at the foot and ankle from this view, when a person is going to have their foot come in this way, this is known as inversion. And finally, as they go outwards like this is a position known as eversion. Now I'll go ahead and talk about a couple of the ligaments that are actually located a little bit above the ankle. Now, the first one that I'm going to talk about is known as the anterior inferior tibiofibular ligament. Anterior meaning that it is towards the front, inferior meaning that it is lower, and tibiofibular because it actually attaches the tibia and the fibula together. Now, as we flip the model over and we go to the back, there is another ligament, and that is known as the posterior inferior tibiofibular ligament. So posterior meaning that it's on the back, inferior meaning that it's lower, and tibiofibular because also it's going to attach the tibia and the fibula together. Now, when an individual has a foot position like this, where they're running and all of a sudden they get an external rotation component, you can kind of see on this model here, that really begins to stress those ligaments in through there. And you can kind of see it separating the tibia and the fibula. So, of course, this is going to put a lot of stress and pressure on the anterior inferior tibiofibular ligament and the posterior inferior tibiofibular ligament. When these two ligaments or one of these ligaments are involved in an ankle injury, this is known as a high ankle sprain. And it's called this because technically the ankle is right in through here, which is lower, and these two ligaments are located a little bit higher, thus the name high ankle sprain. There is another section of the ankle that could also be affected in this injury, and that is the medial component of the ankle. Now, you can see on this model that when a person's foot goes into eversion, this is essentially stressing all of those medial structures on the medial or inside portion of the ankle. Now, there is a very strong ligament that's located medially, and that is referred to as the deltoid ligament. So once again, as a person's foot is going into eversion, you can see kind of how that's going to separate right in through there. So that is really going to put a lot of stress through that deltoid ligament. And finally, of course, it's very possible that there was a bony structure involved in this injury as well. You can see that when a person gets a lot of rotation through here, you're going to get some movement of the bones. And this can also put the ankle at risk for something known as a malleolar fracture, where either the medial malleolus or the lateral malleolus can get a fracture, and also something known as a talus fracture right in through here. So it's very possible that as of right now that there are more things going on, but as of right now, unfortunately, they haven't told us specifically as to what's going on. But what I believe based on the video is that he went into that classic high ankle sprain position. Now, the gold standard to diagnose a high ankle sprain is of course some sort of imaging. It is usually the MRI, and the MRI will tell us what grade of ankle injury that Lukaku is dealing with. And the grading scale for that is actually grades 1, 2, and 3. In a grade 1 high ankle sprain, typically you're going to get some stretching of the affected ligament. In a grade 2, you're going to get stretching and partial tearing. And finally, in a grade 3, this is when you're going to get a complete rupture of the affected ligament. Now, the grade of the ankle injury, of course, can influence the timetable to return. But once again, according to his agent, he's very optimistic about his return and even believes that he may return sooner. So that makes me believe that he's dealing with a high ankle sprain, maybe a grade 1 or perhaps a grade 2 at most. A typical timeline for one of those more minor high ankle sprains is around about 4 to 6 weeks, depending on how the person presents. And finally, if it is a more of a severe or a higher grade high ankle sprain, this is when a person can be out for a period of months. So it's really going to be important that we essentially just wait and see what that MRI reveals. And this will easily be able to tell us the grade and the severity of the injury. Now, it sounds like Lukaku, once again, is already working with a physiotherapist, and this is really important because in the initial stages, when that person has just injured themselves, once again, they're going to follow that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, E stands for elevation. And we're going to do this on that individual until they really start to notice a decrease in the pain and swelling. And then after that, that's when we can start to work in some of that gentle range of motion. Range of motion exercises are absolutely essential because you want to make sure that that ankle joint just restores all of the normal motion that that person had before. Then as we move on from there, we're going to start to introduce strengthening to make sure that everything is nice and stable. Then as they start to do very good with everything and their follow-up appointments are going well with the physician, this is when we can start to tax the system a little bit. We will really start to progress those weight-bearing exercises and do a lot of things on just standing on that injured foot. This is very important because as you start to work in this proprioceptive training, this is going to essentially train the body to just stabilize that ankle in a position when they are standing on one foot, which would be very valuable in Lukaku's case because he is doing a ton of running and he's also going to be kicking and doing a lot of things where he's standing on one leg. So that'll be very essential for him. And as he progresses from there, then they can start to introduce sport-specific movements. So as of right now, it does unfortunately look like Lukaku will be missing a few weeks depending on the severity of that ankle injury. I do believe it is that high ankle sprain just because of that position that his foot went into regarding the rotation and the eversion. But of course, it is possible that there are some other things going on. So that's why it is very essential that we know the imaging results. But it is great news that his agent, as of right now, is very optimistic regarding his return. If I happen to hear any updates regarding Lukaku's case, I'll be sure to update everybody in the comment section. And if you happen to hear anything, please feel free to update me as well. And that's it as of right now regarding Romelu Lukaku's most recent ankle injury. Once again, if you really like today's video and you like this content, please subscribe to the channel because I will be making more videos in the future. Thank you for tuning in and I'll see you next time.